Hello everyone, I'm Ron Barkman, and we'll wait a few seconds. We're going to get started on some information tonight. We're going to talk about total knee replacement and the role of a physical therapist. While we're waiting, we have some information coming in. We've just opened up a new clinic in North Fort Worth, 4901 Golden Triangle. It's in North Fort Worth, just east of 35. It's a really nice, amazing facility. Just opened up for about 2 weeks now, so we're really excited about that, and it's starting to fill up. So anybody that's living out in that area, we'll be glad to give you a great personal service and close to home, so you don't have to worry about traveling all over the Metroplex. Another piece of information is we just hired our first occupational therapist. Her name is Lori, and she's coming up to speed now, and she'll start to take patients any day now. So two big things going on for Barkman Smith Physical Therapy. I'm excited you're all joining us tonight. I want to take the time to thank everybody for the support. We've been here for 28 years, and we hope to keep going strong for another 28 years. I don't know if I'll be here that long, but we'll try. Alrighty, I think we're ready to go. Like I said, I'm Ron Barkman. I'm a physical therapist and co-founder at Barkman Smith Physical Therapy. If anybody's listening that has experienced knee pain, you know that it can be very debilitating. It is not something to take lightly. It's not something that's going to go away in a short period of time. If you're not getting any kind of progress within the first week or first month or so, you really need to look into it and see what needs to be done. Do some testing, look into procedures, and try and plan all your elective procedures so that you can get ahead of this. If you do your work ahead of time, even if you have to have surgery down the road, you'll be feeling much better. And the rehab goes so much better. We're going to discuss the role of physical therapy in total knee rehab. How much force do you think you exert on your knees when you're walking? I'd love to hear your thoughts. Now give it a second. People don't think about it, but when you're walking in a normal pace, you put 3 to 5 times of your body weight on your knees. And if you start to walk quickly or jog, you're putting 7 times your weight on your knees. That's a lot of information, a lot of pressure on your knees. So we've got to make sure that you wear good shoes, look at the surfaces you're dealing with, and try and reduce that force as best you can. Those are significant numbers, and that's why things start to break down. We normally talk about that you're paying for your raising, so the things you did as a child, both athletics, work, that kind of thing, it will come back to get you in your golden years. So we want to make sure that you take care of things ahead of time. Why would somebody need a total knee replacement? That's a big deal. You have some people get what's called degenerative arthritis. You start to lose the bone in the end of the joints in the knee, and everything starts to break down. The angle of the knees can go in and out. You can lose muscle tone. You can start to break down the joints that go down below the end of the bones, and that gets to be a lot more severe. Normal wear and tear will come just from normal life, just standing on concrete all day. You'll get inflammatory arthritis or osteoarthritis, and that's something you need to take care of along the way. A total knee replacement is basically resurfacing the joints. You take off the ends of both the femur and the tibia, and you replace with metal caps, and then you have plastic inserts for the cartilage, so that they take the joint off from here to here, and everything is replaced, so you have a brand new joint to deal with. Now the benefits of physical therapy, that's where we come into play. You got to get your range of motion first. Many people go into it with a tight knee or a tight joint to begin with, and that causes trouble after surgery because all the soft tissue is tight. So initially, right after surgery, within the first several weeks, we like to get from 0 to 90 degrees, so about an angle like that. If you can get to that first goal of 90 degrees, everything else gets a lot easier from there. But ultimately, we have to get that done, and if we can't do it that way, then we have to worry about other things like manipulations under anesthetic. That is not the way we want to do it. We want to do it slow and easy. You'll have a certain amount of pain right after surgery, and we have a patient that's going to talk about the pain he experienced within the first 2 weeks. That's the toughest spot. But if you can get through that first 2 weeks and get your range of motion and start to build some strength, you'll definitely see the benefits of coming through it. And by the first month, second month, you're starting to really feel good. This is not a quick procedure. This is something that doctors will tell you that it takes 6 to 12 months to totally heal. That's total healing. You'll get a lot more benefits within the first 3 to 6 months, but it's shown that exercise is definitely beneficial. You think about when you've had this major knee surgery and things are replaced, you really, should I move, should I not move? We have to get you going. We have to get the muscles pumping. We have to do some open chain exercises like just sliding up and down and moving the joint so that it stays loose. And then we can get some closed chain exercises, which is your foot is fixed and you're working your body weight against gravity, and you can start to build the muscle strength again. Gait training is very important at this point because your natural tendency is to want to keep that knee straight and slide along. We got to get back into a normal gait pattern. A normal gait pattern will help everything to move more comfortably. You have a whole chain of events from when your foot hits the ground, through the knee, up to the back. And if we don't get the knee going properly, then that will affect your back movements and you can get back pain out of that as well. One of the big things you have to avoid to begin with in the first several months is trying to kneel down on the ground. So there are some assistive devices we can get you to help reach down and pick things up. But kneeling is the most difficult. We want to make sure that that prosthesis starts to heal well and stays in place. We don't want to jar it around. They're really good. Doctors used to tell us that they were good for about 10 years. Now they're talking about 20 and 30 years because the advances in medicine have come so far. And I'd like to introduce one of our patients. His name is Bob Leeper. Come on in, Bob. If you just talk a little bit about yourself, and then we'll have some question and answer.
Good evening. Yes, I had my knee replaced on August 9th, and it was my second time at the rodeo because I had my right knee done about 11 years ago. So going into it, I had a pretty good idea what to expect, but I still reviewed all the education materials from the hospital, which gave me an up-to-date view of what they would do. So we went forward, and why did I make a decision to have the knee surgery? Because it hurt. I was tired of walking around on a knee that was giving me pain. So I went to my primary care physician and said, let's talk about this. So they did examinations in vision?
Yes, the MRI.
Yeah, okay. So they did an MRI, and they decided, yes, I did in fact need replacement sooner than later. Both sides of my meniscus were shot, and I was having pretty significant pain. So that's why I did it.
So at this point, what do you think? Did you make the right choice?
Yeah, I mean, I had my doubts. I had my doubts at the beginning of this. I forgot what it was like at the beginning.
The first 2 weeks are rough.
Yeah. I mean, the first 2 weeks are rough, and you really need to pay attention to everything that everybody says about what you need to be doing. By everybody, I mean all the medical people.
What do you think about what's the difference now with your pain as opposed to before surgery?
Well, it's much less now, even though I'm still not wrapped up with therapy, but I have my full range of motion, and the pain is really minimal. It's less now than it was before I went in.
What do you think about how have we treated you? How have things gone here? Do you feel like we're pushing too much, pushing just about right? Where are we in your progression?
I think it's been about just right.
Okay, good.
We've been through this before, and the therapists here working with my knee have been doing a great job, and I'll come back.
Well, we hope you don't have to, but if you do, what is this? Well, you've had our previous experience with this. What do you think about your progression? How's your rehab progress coming along here? Do you feel like was it different than the first one?
I don't remember the first one.
No?
No, it was 11 years ago.
Yeah. Yeah.
And I've gotten old in the meantime. So.
So the recovery process is going along ahead of time, or as you would expect?
I'm told I'm a little bit ahead.
Yeah. You're doing well. You're doing well. Why don't you go ahead and sit back here? And just go ahead and extend your knee for us. And then bend it. And this is from, what day was your surgery?
August 9th.
August 9th. You're about 6 to 8 weeks out. And he's got great range of motion. His strength is coming along nicely. He's doing very well. And this is normal. This is not something, he is an above average person, of course, but this is not extraordinary. The knee surgeons have done a great job. The technology is great, and we're just very pleased with the way this comes along. Rarely does it happen that it gets locked up for whatever reason. This is why you want to start your therapy, and you want to do it every day. Once you start with therapy here, we tell people you have to do it here and you have to do it at home. What you do at home is just as important as what you do here. So you got to do a little something every day. There'll be bad days. You can take a day off here and there. But overall, you have to make sure you keep this going, because the scar tissue, when they make a cut this big, there's all kinds of scar tissue in there. And you think about it, they don't put each individual layer back together again. They lump them together, and the movement's going to get it sorted out. And you'll feel popping and snapping and everything, right?
Oh yes, even today.
And that'll go on for quite a while, but it's just one of those things that it scares the heck out of you the first time you feel it, but then once you know that you're actually breaking up some scar tissue, everything gets a lot better. So we really encourage you to do it here, do it at home, and make sure you keep this thing going. You've got to keep, this will still keep healing. The majority of the healing will occur within the first 3 to 6 months, but it will slow down and it will continue to heal for the next 6 to 12 months. So you got to keep this going. Do you have anything else to offer?
Only that I knew what I was going into because I'd been there before, but what I heard back then was that if I didn't do the therapy, then I would be unable to walk normally because I would lock up.
Yes.
So I paid attention to that and did everything I was told to do.
And you feel like you're getting back there.
Yeah.
We're close.
We're close.
And if you were to see him walk for any length of time, he does a great job. And we always, try and get back to normal gait pattern as quickly as we can, the normal heel-toe pattern, and try and build from the ankle to the knee and all the way up into the back. We don't want you to have any other problems with pain in other body parts because you're not moving properly. Do you guys have any questions out there? Is there anything? We have some questions coming in now. Is it possible to wait too long for a knee replacement? That is a possibility. We talked about they replace the end of the bone, but sometimes people just can't deal with the pain, or they can't deal with the idea of a total knee. What happens is it gets down below the end, it gets down into the actual the bony structure down below that, and it takes more and more effort to try and get that. You have to have a bigger prosthesis, and it takes more and more to get it back to a normal level. So we have to make sure there's a happy medium. You don't want to let go too far. The surgeons will tell you, you need a total knee. You come to me when you're ready. You have to know when that time is to be ready for it. You have to be mentally and physically prepared for this, so that you don't let it go too far. It becomes a worse and worse problem. The total recovery time for this, like I said, it's 6 to 12 months. You're feeling a lot better before that, but in 6 to 12 months, you'll have your maximum healing. If we're not where we need to be within that time frame, then the doctors have to do things about it, like the manipulations, and you're still on medications. We want to get you back to a normal lifestyle so you can enjoy things again. What do you want to get back to? What do you like to do?
I like to ride my bike. I'd like to be able to go up and down stairs comfortably.
Mm-hmm. Do you have stairs at the house?
It's 15 of them. And it was a challenge, but
You're getting there.
I'm doing good.
Good. Can you go one step after the other, or
Yes.
you do it one at a time?
I can go.
That's a normal pattern on stairs, just one step after the other.
Yep. Up and down.
Okay. What if I'm not a candidate for total knee replacement? Can therapy help? Yes. We can control arthritis to some level. If it's not too bad, we can build up muscle strength, we can get your range of motion, and we can postpone the inevitable. Sometimes people catch a break, and it really doesn't bother them that much. They do studies where they show MRIs, and the joint looks horrible, but the patient doesn't have a lot of pain. So you go by how it's affecting your life. If it's affecting your daytime, if it's affecting your sleep at night, you really need to do something about it and try and get ahead of it so that you can do it as an elective procedure and not an emergency procedure where you're in such pain that you go into the emergency room and they're trying to find an orthopedic doctor to do something about it. How many times a day do we like to do exercise? How many times are you doing them at home?
Once.
So once a day is a minimum. If you can do it, twice a day would be even better, because we're not doing anything exercising too bad so it's too strenuous. We want to make sure we're just kind of chipping away at it. So we're making small incremental progressions along the way and not trying to just crank on it and get it loosened up all at once. That's the difference between doing therapy on a regular basis and a manipulation under anesthetic. They literally put you under general anesthetic and move the joint through a full range of motion. It becomes traumatized, it becomes swollen, and it's sore, you can imagine. And then you have to come back to therapy the next day to just make sure it doesn't tighten up on you again. Are there any activities I should avoid even after a complete recovery? We don't suggest a lot of kneeling. There are ways of getting around it. Now, Bob's had both knees done, so like we said, I think initially, we have assistive devices you can use to help pick things up off the floor. You can do things, they call it a golfer's lift, where you can kind of lean down and pick up this objects off the floor there without having to take a deep knee bend. But we try and stay away from that. Try and stay away from any kind of really heavy-duty lifting, because when we tell you to lift, we tell you to use your legs. But if they're compromised, then you end up trying to do too much with your back. So try and keep your heavy-duty lifting down to a minimum. Look for help using a mechanical device if you need to. Now the question is, what level of activity can I expect? We have people playing golf, we have people riding bikes. It's really up to you to see what you can do. It depends on your muscle strength and your mental strength. If you feel like you want to try things, we have people with total joints playing tennis, playing golf, doing all kinds of active sports that they wouldn't think they could do ahead of time, and they couldn't do it ahead of time because the joints were literally breaking down. And if you let it go long enough, you can end up with severe injuries, and some folks will end up in a wheelchair. One of our therapists is contacting me, yes. I will skip that question. If you have any other questions, please give us an indication of what you'd like to talk about. One's coming in now. Are there steps to postpone the need for a total knee replacement? Medications, anti-inflammatories can help that. Then you have to watch other organs, but you can use anti-inflammatories, icing, heating, elevating knees, compression hose that will help to keep the swelling down to a minimum. The swelling is the big thing. As you allow more and more swelling to come in, it just pushes everything together, and it increases your arthritis. The bones start to break down, and then we really have no choice at that point. I think we're okay with our questions now, and I want to thank you for joining us. I want to invite you to reach out to me if you have any questions here at Barkman Smith Physical Therapy. The number is 817-283-9435. Feel free to stop by, give us a call. We're here 5 days a week, actually 5.5 days a week. We have a Saturday morning schedule we keep up. And if you have any problems or questions, please stop by and see us. We're glad to talk to you about it. Our next one is going to be Facebook Live in October. It'll be getting to know your therapist, and we're going to be talking to one of our physical therapy assistants, Serena Burrell, and she's really done great things with our balance and big program, and she's been an invaluable asset to our staff here. So thank you very much, and I hope you have a great day. Stay healthy.